Hi, I'm Rob Marino. I'm the director of the Fauquier Free Clinic. I wanted to welcome you. Since we can't meet in person, we wanted to show you what we're doing here at the Free Clinic in 2021. We think that we've gotten a great solution for how to take care of patients and meet our mission, despite all of the difficulties that we all face in this world right now. So come on in and we'll show you what we're up to. Give me a moment. Fight with my mask. Here we go. So now here in our lobby, you'll be greeted by our staff or volunteers who do screening for all the patients who come in. Like Darlene and Lacey are working here today, and I'll let Darlene tell you what they do.
So when a patient comes in, we have them hand sanitize. We go ahead and clean their hands of any bacteria from the outside. Then we go through a short screening process, ask them all questions of any COVID symptoms or known exposure. We check their temperature, we give them a screen sticker to show that they're A-OK, and they go on to their appointments.
So once the patients are cleared, we come on back in to see the doctor or the dentist or our mental health counselors. We'll come into the nursing area right now. So here in the nurses station, our team are masked up all day. We've all gotten pretty used to the mask by now. And we have a few different options for patients. We're doing just as much patient care in 2021 as we did in 2020, as we did in 2019. It really hasn't diminished at all. In fact, the need is only grown. Come on in and I'll introduce you to Sarah, one of our nurses who helps get all our patients taken care of, and she can tell you what you might experience.
Hi, so we have patients that come into the clinic, and when they come in, we have them obviously masked, and they come in, sit down, and we get their vitals. We also have the ability for our docs to do a telehealth visit, and the doctor will either come into an examination room or stay in their office, and we have the ability for the patient and the doctor to communicate on the computer, and that way if the patient is experiencing any signs and symptoms that might not be good for them to be out in the public and to have an actual office visit, then they can communicate via the computer and have a telehealth or even a telephone visit.
So what a lot of people don't know is that we do COVID testing here at the clinic, and let's go outside. We have a few reserved spaces, and what we do is we come out here. We have 3 reserved spaces for patients to park in, and I will actually be gowned up and I will come out and explain to you what I'm about to do and answer any of your questions, take your temperature, get your pulse and your oxygen ratings. We'll do the swab. It takes about 15 minutes, and I will come outside and give you your results. We also do PCR tests, which we send out to the lab, and we get those results in about a day or 2.
Another thing we've had to make a lot of changes is just how we get medicine to our patients. To do that, probably the most important part of treatment is the prescriptions that our physicians can get to the patients at the end. And Jody here has helped us manage all of the different ways we're doing that, and I'll let her explain what we're up to.
Yeah. We can actually take your prescriptions right to your car and give you them in the parking lot. We can send it to Walmart if you need us to send it there. We have volunteers that will help out and try to deliver it to your house. And basically we'll help any way we can.
So the part of the clinic that's had the most changes through COVID has been our dental clinic. And I'm going to let Dr. Hassan talk to you about the precautions we're taking and the actions we've had to take and changes to keep us all safe.
Thank you, Rob. Hello, everybody. So I know that since the pandemic started, it has been very tough and people are already scared to come into the dental clinic anyway because of dental phobias. And COVID doesn't make it any easier, but we have tried our level best to make it as smooth and as safe for everybody, from the patient to the dental staff to everybody that works here and comes into contact with us. So before the patient comes in, we make sure that we have screened the patient, and once they are here, we are wearing protective equipment, double mask, shield, The rooms are scrubbed clean. If they were scrubbed clean before as well, before COVID, but now it's like on the double, you know. And then we have HEPA filters in every room. We make sure that, you know, everybody is at a safe distance. It does introduce an additional amount of time, and you know, we have to spend extra time taking care of all of these precautions, but it makes sure that not just the patient, but everybody over here, the staff, the doctors, everyone is safe as well. And so far, thank God, we haven't had any exposure or any scare like that. So yeah, I mean, we're trying our level best, and so far all the staff, everybody feels safe.